Hello, everyone. I just wanted to share a PowerPoint lecture that I did with you, and I hope that you find it helpful and that it gives you additional insight into the many phases of trauma and the effect of adverse childhood experiences on long-term emotional and physical health. So this is just a simple question without any pretext, but based on your current understanding of an ACE or adverse childhood experiences, think back or reflect upon your own childhood and ask yourself if you experienced an ACE. So reflect now on your life as an adult. Do you or have you suffered from any of the following conditions? And remember, obviously, this isn't an exhaustive list, but these are just some examples that I have up here of autoimmune disorders, substance use disorder, eating disorders, mood disorders, anxiety disorders, criminal behavior, personality disorders, intimate partner violence, digestive issues, chronic pain, etc. So think about this and then tuck your responses away in the back of your head, because we're going to talk about them a little bit later in this PowerPoint lecture. So what exactly is an ACE or an adverse childhood experience? Many of us have this image of physical or sexual abuse, but an ACE includes so much more than that. It's really just any experience that induces fear of abandonment, fear of physical pain, fear of death. These can include, but are not limited to, these that I have listed on the slide, which include natural disasters, absent or insecure attachments, parent mental illness, living in a poor or violent neighborhood, parental divorce or separation, NICU, being such as being born as a preemie, being in the NICU, prenatal stress, prenatal teratogens, authoritarian parenting style, witnessing intimate partner violence, abuse of any kind, and neglect. Okay, so the still face experiment. Many of you guys have seen this experiment. If you haven't, just Google it and watch the short little 5-minute video clip of this experiment, because really, what I wanted to highlight about this was it really shows the phases of distress that a baby will experience when he or she doesn't receive that responsiveness or secure attachments from from the baby's mother. So it's really to help you, showing this to you is really to help you understand that ACEs can be something this simple as a mom or a father not giving that attention or engaging with the child in these simple ways, whether it's eye contact, whether it's physical touch, whether it's responsiveness to needs. So in this still face experiment, it took only just a few minutes, but can you imagine the effects of repeated inattention? Even when we leave our baby to cry it out, because after all, remember, that's what we were told to do, right? That's what all the experts used to say. Well, now we know that leaving a baby to cry it out changes the brain. In fact, imaging studies have found that when a baby is left to cry it out, the brain demonstrates an anxious pattern of activity, mostly at that HPA axis. This pattern continues even when the baby stops crying. So it's almost like a sense of learned helplessness. And what Dr. Sears, in several of his books that he's written, he's a pediatrician, referred to as shutdown syndrome, which is really just the overactivation or the hyperactivity of the HPA axis, like that fight or flight response. The same thing happens in the brain when a person dissociates or when a person experiences any sort of ACE. So let's look at pandemics as another ACE. Pandemics only become ACEs if a child knows about them and if he or she is fearful. For instance, the flu has been around forever. And it kills more children each year than COVID, but yet it has never created the fear in children that COVID created. Why is this? And what impact did COVID have on the lives of children? For most children, it wasn't necessarily the virus itself that affected them, but rather it was the lockdowns, masking, fear messages, the images on TV, and the social distancing protocols. All of these created fear. And what made this even more dangerous is that, unlike some stressors or traumas, this one continued for days, weeks, months, and to some extent years. It's like being faced with trauma over and over and over and over again. There was no escape from this ACE. And masks automatically arouse a fear response. Think about this for a second, because masks, what are they associated with? Halloween, bank robbers, they're scary. Even before COVID, they were actually illegal in many US cities and states. So masks are just known to kind of be one of those things that arouse a sense of fear. And also, what happens when people put on a mask? It generates a sense of anonymity. There's a sense of disconnect between people. So when children were seeing masks during COVID and even wearing them themselves, it became a visual reminder of this invisible virus. So it aroused fear, which leads to the hyperactivity, again, of the HPA axis. Similarly, being bombarded with messages on social media and then from their parents and teachers, and this all became constant reminders of doom and gloom, which led again to the chronic hyperactivity at the HPA axis. So remember, any fear leads to the HPA hyperactivity, but when that fear is chronic, in a chronic state of fight or flight, children who struggle the most during COVID, at least the ones that I saw in my practice, were those whose parents were overly fearful and anxious and talked about COVID all the time and were just very, frightened themselves. Because remember one thing, this is really important, is when children will take the cues from their parents. And as a parent, it's our job to help them feel safe, even if we have to fake it, even if we are afraid ourselves. And with COVID, many parents were so afraid themselves that they didn't help their children feel safe, but rather they exacerbated those fears. Children then were, they're being bombarded from all angles: school, stores, home, social media, everything. These fear messages led to a perpetual state of the HPA hyperactivity. So when this happens, it creates changes in the brain, which we're going to talk about in just a minute. And these changes obviously will lead to symptoms. So just how do ACEs affect the body? So stress and fear leads to hyperactivity in the HPA axis. So this is the hypothalamic, pituitary, adrenal gland, the whole axis, which is all connected. And hyperactivity at the HPA creates what we know as the fight or flight response. And when this happens, there is an increase in cortisol, which mobilizes the glucose, which is stored in the liver. This provides the energy to deal with the stressor. The heart rate increases, the muscles become tense, and the person wants to run from what they perceive as a dangerous situation. When a stressor dissipates, ideally, the HPA axis settles down and the cortisol levels decrease. But what we see with trauma or any ACEs, especially those that are prolonged and continue on a regular basis, the HPA stays hyperactive, which keeps the cortisol level high. And high cortisol can interfere with so many things, such as learning and memory. It can induce psychiatric symptoms and cause physical disease and illness. Because when this happens, when our HPA is constantly upregulated or hyperactive, it can increase inflammation in the body. It can induce changes to hormones. It can unbalance the neurotransmitters, and all of this together can lead to symptoms, both physical symptoms and psychological symptoms. So again, when we see the hyperactivity at the HPA, we see an increase in inflammation, changes in hormones and neurotransmitters, even changes in the structures of the brain. And we can also see epigenetic changes. So what we see is this chronic hyperactivity at the HPA can increase the risk for Alzheimer's, depression, autoimmune disorders, cardiovascular issues, cancers. So childhood stress or trauma can even change the structures of the brain or interfere with the development of certain structures, including that of the amygdala. The amygdala is a tiny part of it plays a huge role, but it's a tiny area of the limbic system. And we know that the limbic system continues to develop through adolescence. So when children experience multiple ACEs or a chronic ACE, it can interfere with the development of the brain structures. It can also, as we just mentioned here, lead to epigenetic changes. These are changes to the genes as a result of the environment. And this is huge because up until just recently, we believe that a person's risk for certain diseases was based solely on his or her inherited DNA. However, recent research has shown us that, according to Patron and colleagues, that only 5% of diseases are determined solely by genes. And, quote, the vast majority of diseases, including many cancers, diabetes, and Alzheimer's disease, have a genetic contribution of 5 to 10% at best, unquote. So, again, what we're seeing is that these epigenetic changes that the environment has on our genes increases our risks. And again, what are those environmental factors that can lead to those changes, lead to epigenetic changes? Well, obviously what we're talking about is the ACEs and trauma can lead to those changes. So when children experience a chronic or acute ACE or multiple ACEs, it can affect the brain. And what happens is that this can manifest in any number of symptoms, and it can even look like other disorders. So some of the symptoms that we see in children include nightmares, enuresis, sleep disturbance, separation anxiety disorder. One of the most common symptoms of the COVID ACE that I saw and see in my practice in children under 12 was separation anxiety disorder. Now, the parents didn't always make that connection to trauma, but whether they would bring their child to me and tell me the symptom, such as my child doesn't want to go to school, or my child becomes terrified when I go out on my evening jogs. These behaviors, though, didn't occur before COVID, but rather after. And in all of these situations that I saw, the ones with separation anxiety disorder, the parents themselves were hyper-focused and anxious about COVID. And so again, as I mentioned previously, parents often shape the child's fear response. And the role of parents, we have many roles, but one of them is to help a child feel safe, even in the face of danger. And this wasn't always the case with COVID. So we saw, so many reactions from children. And interestingly, it's one of those things that we don't know what the long-term effects of all of this was, because we're still sort of going through it in a lot of states, but we probably won't know, for 5 to 10 years from now, the long-term effects of that this COVID lockdowns and fear messages had on children. But look at all of the ways that an ACE can manifest in children. Again, regressive behavior, sleep disturbance, OCD, bullying, conduct disorder. So you name it. So when somebody comes into your office, it's important to take that ACE assessment. You don't even have to necessarily ask them specific questions about ACEs, but really just observing and listening attentively. Sometimes I'll have them draw pictures. We'll play games. We'll engage in play therapy with them. And a lot can be discovered in the process of play therapy or art therapy. So, how does an ACE manifest in teenagers? Some of the symptoms are similar to those that we might see in children, and some are a little bit different. But when we have the hyperactivity at the HPA axis, and again, the inflammation in the brain, the changes in the neurotransmitters, changes in the hormones, what we see is this manifests as symptoms, and this manifests in different behaviors. So, we see oppositional defiant disorder, also referred to rebellion, substance use or abuse, suicidal ideation or attempts. We see academic struggles, even criminal behavior. We see teenagers joining gangs, promiscuity, cutting, or other forms of self-mutilation. There's even eating disorders and anxiety and panic attacks, as well as the vulnerability to sex trafficking. So it's really important to remember that that any type of ACE, for instance, poor attachments, is going to, unless there's some sort of intervention, is going to reflect in different behaviors that we might see in a teenager. And even when we go back and we look at the COVID ACE, I definitely saw a different response from the teenagers that came to my practice. And many of their symptoms were different than those that I saw in children. And what I would see and still see with my teenagers is often eating disorders. Anorexia was a big one, because what happens with the COVID, it's that feeling of not having any type of control. And so the eating disorder, anorexia, focusing on food, gave them that sense of control in a world that was full of unknowns. So their fear was more of the fear of the unknown, the fear of the unknown future. It wasn't necessarily fear of the virus itself, but fear of missing out on things, whether that's graduation activities, homecoming, prom, that kind of thing. So I saw a lot of eating disorders. I saw substance abuse. I saw suicide attempts. I saw cutting, all as a reaction to the COVID messages and the COVID lockdowns. So, what exactly happens when your brain gets stuck in that fight or flight mode? When the brain senses danger, even when there isn't any. It's like the bucket is full. If we had an analogy or metaphors, the bucket is full, and one event or even no event can lead to the bucket overflowing. So anytime we are in that constant state of fight or flight and internalizing emotions rather than expressing them, we're going to have symptoms. These could include anything from chronic pain conditions to autoimmune disorders. So with chronic pain, what we see is that danger signals sent up by the brain often show up as physical pain, and fear and pain go hand in hand. So the nervous system is hypersensitive, and it has spent years in this constant loop. So, we see this reflect in so many different symptoms in adults, whether it's anxiety disorders, relationship issues, personality disorders, autoimmune disorder, so you name it. And again, it's not always connected to an ACE, but I would say probably 70% of the time we do see that connection. So just how many people experience ACEs? I would probably venture to guess about in this day and age that probably nearly 100% of people experience an ACE. Does that mean that everyone who experiences an ACE is going to have symptoms or is going to have long-term effects? No, that's not what that means. In fact, sometimes ACEs can lead to resilience. It's really there's a number of factors that go into it, but there's been a number of studies. In fact, one in 2013 found that 83% of adults have at least one ACE. Again, that was nearly 10 years ago. I would say that those numbers have jumped to probably nearly 100% after all this COVID craziness. So 98% of the prison population have experienced an ACE, and higher ACE scores on the ACE questionnaires positively correlate with more negative outcomes. For instance, according to the Compassion Prison Project, 1 or 2 ACEs, if a person experiences just 1 or 2, They are 2 times more likely to smoke, 4 times more likely to develop STDs, 3 times more likely to be on antidepressants. Someone who experiences 3 or more ACEs is 60% more likely to experience autoimmune disorders. 4 or more ACEs, that can lead to a 2.5% more likely to be diagnosed with cancer or lung cancer, 4.4 times more likely to have chronic depression, 15 times more likely to have suicide, and 7 times more likely to go to prison. So how do we as counselors identify and diagnose ACEs? Now, obviously, I mean, you guys all know that ACEs is not a disorder, in the DSM at least. So ACEs is an event. ACEs is, but being aware of some of those, events. And again, trauma and ACEs can be 2 different things. Some ACEs are considered trauma and some are not, but all of them can have an effect on the HPA axis and lead to same similar symptoms. But it's important for us to assess our clients and to ask them questions. We don't have to do a formal assessment for trauma or for ACEs, but rather just listening, asking opening questions, observing, recognizing symptoms, and ruling out other disorders. This is really our ethical requirement as clinicians, because what happens if we ignore the ACE or trauma wounds and diagnose the symptoms rather than the cause? So when we do that, the child or even the adult doesn't get the appropriate treatment. They continue to live with those band-aided wounds, and now they have a label of a mental illness, whether it's ODD, ADHD, etc. So, so it's really important to rule out these other disorders, to really think about, what is contributing to this, these symptoms. And sometimes we have to make those connections because our clients don't always make those connections. So just be vigilant and be aware and listen attentively and ask those questions. So how exactly do we treat trauma? There's a number of ways we treat trauma in therapy. There's play therapy, art therapy, trauma-focused CBT, EMDR, psychoeducation. I'm not going to get all into this, but I just wanted you guys to be aware of a few different treatment modalities. So how can we as parents, counselors, educators help mitigate the effects of childhood trauma, childhood ACEs? In other words, what can we do to keep them from becoming long-term issues? First, we can help children talk about the ACEs. We can ask open-ended questions such as, tell me about, or what are you feeling? And we can listen attentively without judging. And so think about that. What does attentive and active listening look like? For one, it requires being present. We're not sitting there scrolling our social media. We're not texting, but rather we are actively listening by maintaining attention and gentle eye contact. We might even engage the child in an active, some sort of activity such as playing, kinetic sand, or talking while engaged in some other sort of game. So children are often more likely to let go of their defenses when engaged in play or some other activity. I use the kinetic sand in my office all the time. I get down on the floor with them, and it's amazing the things that they will reveal when we are engaged in a play activity together. So parents can also maintain a sense of routine with their kids. This is especially important because one of the things that I noticed during the COVID craziness was that the children who fared better were those who were given some sense of normalcy, as hard as that was, or routine. Children who suffered the most were those who had no routine and those whose parents were overly anxious and fearful. Remember, again, children mimic the parents, and they often take on the feelings that are being expressed around them. So sometimes parents have to fake calm in order to protect the children. So what else can parents or educators do to help a child overcome the effects of trauma? So that's something to think about. Here's some other things to ponder. Is trauma the real cause of ADHD? How many of the DSM disorders are really trauma disorders. So when I first got into this field, which was some 20 plus years ago, it was hammered into my head repeatedly that ADHD was a brain disorder. It was not caused by bad parenting or bad environments, but rather it existed since birth, due in large part to heredity, and sometimes it didn't manifest until the early school years. But my question is this: could it be possible that ADHD is really caused by trauma or ACEs? This could even be anything from traumatic exposure in the womb to a baby's experience in the NICU to abuse, insecure attachments, loss, etc. during those first years of life. In fact, several studies confirm a disproportionate increased frequency of early trauma in ADHD sufferers compared to non-affected individuals. In fact, in a study in 2012 by Frederick and colleagues found traumatic life events 1.8 times more frequently in ADHD sufferers than non-afflicted individuals. And then in 2021, according to Zaccaro and colleagues, 20 to 50% of all children who experience early childhood trauma develop clinical ADHD symptoms. Several studies have found a link between abuse and ADHD. And Stern and colleagues in 2018 found abuse was 3 times more common in girls with ADHD than in those not affected. Another study by Gotkin and colleagues in 2016 found that children with ADHD were 3 times more likely to be abused, twice as likely to be physically abused, and 2.5 times more likely to be emotionally abused. But how does this tie in with the dopamine deficiency that is associated with ADHD? What we've heard about, the low dopamine. So although it's not yet proven that early childhood trauma and ACEs increases the ADHD risk by altering the dopamine system, there is strong evidence that trauma, both early childhood and adolescence, permanently alters the brain's dopamine system. And it does this via the HPA axis that we talked about previously. According to Bloomfield and colleagues in 2019, hyperactivity at this axis can influence the dopamine synthesis and dopamine receptors. This really begs the question, too, of how many DSM-5 text revision disorders are really symptomatic of childhood trauma and ACEs. When we think about the way that trauma changes the brain, it's easy to understand how symptoms and disorders can arise. But with all of the trauma in this world and with nearly everything being considered as trauma, it is likely that we all have a disorder or disorders of some kind. So, as a caution, I'm going to end this PowerPoint presentation with a few words of caution. As counselors and educators, we have to be cautious about putting words, or in this case, traumas or ACEs, into the person's mouth. We don't want to lead or guide the child or adult, and we don't want to assume that every symptom a person expresses is a symptom of trauma. We have to be cautious about imposing our own preconceived ideas onto the individual. I think many of us in here remember or maybe not everybody, but several of us might remember the repressed memory therapy back in the 1980s, where nearly every client was suddenly having memories of sexual abuse. The problem was that most of these people were never sexually abused, but rather suggestions by the therapist, who many times had good intentions, contributed to the false memories. So we don't want to be those therapists. I think we also have to be cautious about turning our client into a victim. We live in a victimhood culture where the media convinces people that they are a victim of something, you name it, fill in the blank. And this doesn't really help people. In fact, it keeps them enslaved and stuck rather than empowered. So we don't want to be part of this movement where we contribute to this victim mentality. The reason we should even ask about trauma or assess for trauma or ACEs is to help clear the cobwebs so that the client can move forward, not so that they can stay stuck. And I think it's really important that we make this clear, because I have seen a lot of families destroyed by this victim mentality where blame, anger, and victimhood sever relationships. Our goal, in most cases, now I'm not talking about those severe cases of sexual abuse, violence, etc., but our goal is to restore relationships and to teach people how to be better for one another. Because quite honestly, now that just about everything is considered an ACE, every child, especially in the age of COVID, will have experienced one.